Okay, so we have a few questions. So we take questions for Frank, Andrea, and Mark. I collected a few that are online. Maybe let me start with the first one here. So I was wondering, as a question to Frank, did you look at other protein drug combinations than the ones you talked about, or could you look at all combinations of the proteins which are, let's say, likely to be involved with all approved drugs, or is this computationally just too expensive to do that? Of the interactions, right? So
yeah, so we have not. We have focused on this particular protein, and the background of that is, honestly, I have been trying hard to stay out of doing anything for COVID-19 because there are so many people trying to do something at the same time, and it's really very hard to do something deep unless you're already in the business. And this particular protein is very similar to one that we have worked a lot on in the past, and we have an experimental collaborator who can test this in the lab. So I think based on this, we're in a position to do something that makes sense. I would be very cautious to just take a random protein, especially given that many of those don't have structures yet. Run some machine learning algorithm and propose some drug unless you have this connection to people that can actually make and test these things. So in that sense, I think this Moonshot project, for example, is a great initiative. But that again, is my understanding is on a particular target, on the viral protease, right? So yeah, so we haven't done others than this particular protein.
Okay, good, thanks. I think there was a question by Shakir. Maybe you want to ask it online.
Hi, yeah, thanks. My question is for Frank. I really like the element of your talk in that it shows just how many interesting questions for machine learning research comes out from this work of chemistry and biology coming together. In particular, you mentioned the role of generative models that appeared in many places, whether they were normalizing flows for densities or unnormalized models to deal with the Markov chain transitions, or later on GAN models to do different kinds of synthesis. So I wonder if you could say a little bit about where you see the failures of those models coming up right now in the spaces that you are looking at. I know you showed a clip of one of your recent papers, but and just sort of the avenues for new research that sort of have been coming up, that where we need to do more work in generative models research, which is coming up from the kind of applications that you're looking at. Thanks again for the great talk.
So in general, I would say the challenge that we have here is kind of so the way the generative models are usually used in machine learning is you have a large data set which defines the distribution that you would like to learn and sample from. And we are often in the opposite situation. So often we have something like unnormalized density or an energy model, and we would like to explore and sample it. So we need to be able to explore. And that is, so you have to somehow combine this with some sort of adaptive exploration algorithm or some simulation algorithm, maybe guide MCMC by generative models, etc. And also, I mean, our data is also very high dimensional, and they are often very, very multimodal. Yeah? So you have different probability modes that are separated by low probabilities. And I've found that actually many existing generative models have a lot of problems with that. And also in generative, in the flow work we have done, we find that many architectures really prefer unimodal results. So either smearing over all of the modes or just collapsing to one mode, depending on which version of the KL, forward or reverse KL, you train with, for example. So I think there is a lot of issues with discovering new modes in for given densities, unnormalized densities, and accurately representing multimodal distribution in high dimensional spaces.
I have two questions which are related to Andrea. So the first one is, do you have any ideas, proposals for a stronger collaboration between your group and the machine learning community? And the second one, pretty related, do you have any challenges or data sets that machine learners who are not experts in protein structures can work on?
Yes. So the first thing is, of course, that our data are rather suitable as training data for machine learning, no matter what your question is. If it's like applied structural biology, at least here you would get a few structures that have been vetted, and that might be a well annotated set of training data. The other side of this is that my lab is also looking into, as I shown, neural networks and machine learning methods for validating structures. And I think there is a lot to be had. In an ideal world, one day we would even be able to have part of the modeling itself, which currently still has to be manually because the discrepancy is so big, done by artificial intelligence, at least in part, because some of these modeling tasks and some of these errors could well be found by some kind of three-dimensional annotation or pattern recognition algorithm. So while I cannot give you right now something that where we like have a problem ready with all the training data, there's a lot of like possibilities. And actually, just last week, I had a bachelor student starting and finding pathologies in X-ray diffraction data of macromolecules with, well, he starts out with scikit-learn. So these must be very baseline for the listeners of ELLIS, right? So there's a lot of potential, and a structural biology community, we have just started to come together over the last 2 years to focus more and more in this area.
Mm-hmm. What would be the best way to get involved? So should they just write you an email and see how you can collaborate? That's the way to go?
Yep, just write me an email. We're available. I may forward it to someone from my team who's better suited to the question. But so far, we are not at capacity with the emails we get in terms of answering them.
Yes, okay, great, thanks. So Vincent, you had a question? Maybe to Mark or to
Frank? So I think it could be Mark or Frank. So very vaguely, my understanding was that once a COVID patient shows symptoms, like their immune system is already very active, and so they might be already kind of close to the peak in like virus levels. So I was wondering, like, how early do you have to administer an antiviral drug for it to have the maximum effect?
Do you want me to take that one? Yeah, I guess that is a difficult question to answer. Obviously, the earlier the better. I guess we haven't done the models to say exactly how early you need to do it. Obviously, there are different approaches to try and inhibit. Small molecule is, I guess, once the virus is present, then to try and stop the damage it causes. But how early? I guess it's yeah. I can't give you a definitive answer, I guess, but the earlier the better. And I said that that there are other causes of treatment, antibody or vaccine, I guess. But with the antiviral, yeah, that is one of the downfalls, I guess, of it is when you administer and how much disease you can eradicate before it escalates.
Frank, you have any?
Yeah, I would also say so anything that tries to inhibit virus entry or replication of the virus, so anything that targets the population of the virus should be done rather early, because in the early stages you can then reduce the problems that you'll have later. Later in this, if the disease gets really bad, the immune system itself is part of the problem. Like there's an overreaction of the immune system, and then it gets really, really tricky. The good thing, in a sense, is that so when you have first symptoms and you get a test, and you usually have a bit of time until it gets really bad, and where reducing the virus load can be effective. And also, whatever you do there therapeutically, you really need to do it only for like a week or two. So that means you're not exposing the patient to a drug that might not be perfectly made for this particular disease and may have side effects. if you take it for a longer time, because you essentially just try to do whatever you can to reduce the virus load for a week or two, and then you could even maybe give a high dose of a drug that otherwise you wouldn't do if you were to give this drug for half a year or something like that.
Yeah. Good. Okay, I have one more question to Mark. So you get submissions, right? So and you, I guess, collect these submissions, and then maybe some of them are tested. So what's your algorithm, or what's your procedure of going? I don't know how many submissions you get, and how many you can actually test. So can you test all of the submissions, or is there an algorithm picking them, and what's the strategy?
Yeah, so we can't test everything. So of the 5,000 ideas, so the way that it's been working so far is we'll have kind of specific waves or specific questions we want to ask. So maybe it will be just covalent inhibitors, or non-covalent related to a fragment, or non-covalent related to a non-fragment. And then it's a case of kind of mining the submitted compounds to look for the compounds that fulfill that criteria. So we have multiple computational chemists running, different models, docking, MD, for energy perturbation. That's where things like machine learning models could come in to help prioritize. So the idea is to get a priority ranked list of compounds. So synthetic accessibility is another criteria, because we want to get the compounds that are of most interest, that are quickest to synthesize through first. So the compounds are synthesized at a contract research organization. So enamine, so they synthesize the molecules, so they have to be synthetically accessible to get the throughput fast enough. So we employ various computational methods, as the medicinal chemists on the team will look at functional groups and chemists feel for what they think might work. But any sort of computational method, ADME tox models, anything like that we can use to focus in on the most appropriate compounds for a given challenge or task that we're trying to address with a set of compounds. That's how we select.
Yeah. I mean, to a certain extent, I wonder. I mean, one could say that submitters submitted to you, it's a bit of black box when it's never tested. So it could be nice to have a feedback loop where there's some, I don't know, when you do some quality checking, you find whatever that it can't work, and you give that as a feedback to the submissions. That could be useful.
Yeah, I think the feedback is important, and that will be definitely tried. So anything that is selected or isn't selected, to feed that back to obviously people spending their time creating design ideas. And some of the design ideas people will have run through kind of quite elaborate models and assessment prior to upload. So that needs to be taken into account as well. But yeah, I agree that for crowdsourcing to work, to keep people enthused, and you need to give them the feedback on if your compound's been selected and synthesized, feed that, and if it hasn't been, then feed that back as well, and reasons why. So we try to do that as well.
Yeah, great. Yeah, that would be great. Good. Are there other questions in the audience here? So I don't have any further questions online at the moment. So if not, then maybe let me share my screen again. Just a second. So yeah, with that, I would like to maybe thank all the speakers, thank the audience for participating, for asking questions. So we will have the next edition of this workshop likely on June 10th. So this will be again based on proposals for speakers and topics. Please send them to Daniela. Also remember, if you have machine learning work related to COVID, please consider sending it to NeurIPS. And yeah, with that, I would like to conclude this meeting. Is there anybody else who wants to say something? Seb, Bernard? If not, then thank you all for participating, and see you next time.